Hi, I'm Dr. David Mark. I've been with Silicon Valley Eye Physicians since the beginning, which is over 20 years ago. I'm a board-certified ophthalmologist, and I have specialty training in cornea and external disease. Another area of our practice, which I'm involved with, has to do with droopy and tired eyelids. Now, over time, some of the upper eyelid skin becomes a little heavier and starts to droop down. That does a couple of things. One is it makes your eyes feel like they're tired because you're always constantly lifting them. And secondly, it actually can reduce your field of vision, which is really a medical situation. So I like to evaluate these lids in detail, and if indicated, then go ahead and fix that. That's something we can do right here in the office. It takes less than an hour, it's fairly painless, and you're up and around the same day. So people are very happy to have that done, not just for their appearance sake, but also functionality improves. The eyes feel much better, they feel lighter, and things look brighter.
My eyelids were drooping, and every time I looked myself in the mirror, I hated my eyelids. And I wasn't happy. 3 years ago, I had my eyes done, and they still look good. I'm happy, very happy, and absolutely I will recommend Dr. Mark.
I feel that ophthalmology is a very rewarding experience. It takes many years to become an ophthalmologist, but to be able to help people to see better and to eliminate eye diseases is professionally and just personally a very good experience. It's very happy for me to see our patients walking out happier than when they came in.
Hello, I'm Anna Walker, and I'm Silicon Valley Eye Physicians aesthetic nurse. And I'm originally from Brazil, and then eventually I came to this country, to the United States, and I ended up getting my license in nursing in Connecticut. So I'm a registered nurse in the state of Connecticut and in the state of California. And I've been doing aesthetics for about 10 years right now. I love the job that I do because it combines many of the things that I have an interest on. This job that I do depends on medical knowledge, having been an expert in many different kinds of techniques using fillers and neurotoxins such as Dysport and Botox. And also you have to have an artistic eye because I'm trying to look at a total, the full face. Therefore, it's something that I really enjoy doing. The other aspect of my job that I enjoy is the fact that I help the patients to look the best they can and increase their confidence in their jobs or relating in their families or friends, and without having plastic surgery. So we get the maximum kind of optimization for their looks at their age without having to have plastic surgery. A lot of the patients come to me complaining of the fact that they look angry all the time, that people think they're stressed, or they think they're angry that relatives make a comment, or friends, or co-workers. And a lot of the times the reason for that is because of the frown right here on the glabella, that people frown and they have the habit of frowning, either because they've always frowned because of the sun, or because when they're thinking and concentrated they frown. And that can easily be resolved with one of the neurotoxins, like I mentioned before, like Dysport. The other common complaint per se that people come and tell me is that they wake up and they look tired, even though they're not feeling tired, and people mention to them that they seem to be tired. Frequently, that is a combination of things, but a lot of the times it's because they lost the fat pad under the eyes, so they get those dark circles under the eyes. And that can be corrected very easily with filler, with one of the hyaluronic acid fillers. That would be the Restylane or Juvederm, one of those. The other thing that they can have is that people as they age, they lose the fat on the cheeks and on the upper cheeks, so everything starts sagging down, and that makes them look tired and make them look sad as well. So refilling the cheeks and restoring the lost volume resolves the problem as well. Some patients feel that they're looking older than they feel. And a lot of times people just don't want to be dismissed. They don't want to be, they work with a lot of young people and they feel that even though they have more knowledge, sometimes they get dismissed because of their age. So they want to keep a pretty active, youthful kind of appearance, and that's another reason why people come. So when we do the fillers, it does fill up the areas where they lost volume, but the fillers also stimulate some collagen production in the skin itself. So when it wears off, even if people change their mind and decide they don't want to do it anymore, they're not going to look worse than they looked before. If anything, they might look better. It's not like a permanent filler, but it can stimulate some collagen, and the duration of that effect can be a little bit longer than what expected. The other thing that we do, that I do here in the office along with Jane, is to consultate with the patients on products. And we do use the line of Obagi because we feel that that's the one that has given most results so far, and is the most reliable one and the better results. I find that it's very good for the skin when it gets to be a little bit thinner. It can thicken the skin a little bit. The skin, like the pores that are showing too much, refines the pores because it produces so much collagen on the surface of the skin that those pores appear to be closer and tighter. You can also take a little bit of the crepiness of the skin away. It's an appropriate treatment for all skin types. Anybody from any country, of any kind of background can use it. So if you have any questions, concerns about if there is something that can be done to correct something on you, or if you just would like to enhance something that you have that you enjoy having on your face, you can have a consultation with us, and I will give you a very informative educational consultation where I can tell you what your options are, and then you can make a decision whether or not you wanted to proceed. It makes me feel really good when I see people that are losing confidence, being able to regain confidence. I've had patients that, one patient that was, for example, that I can think of right now, that was getting a divorce, and she had no confidence in her looks, her appearance and everything. And right now she is an independent woman. She started her own business. She's successful in the business. She has all the confidence she has. She used to use loads of makeup to hide her skin, and now she doesn't need to use anything, just blush, and she is ready to go, and her confidence changed. I love to see the change that makes on people, how people blossom when they look the way they feel.